Good evening, everyone. Today's session is going to be really helpful and is led by Dr. Maitri Sharan. She is going to talk about heavy bleeding during periods. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hi everyone, good afternoon. Today we are going to talk about the heavy bleeding during the periods. I'm Dr. Maitri Sharan. I'm obstetrician and gynecologist, consultant at Apollo Cradle, Jubilee Hills. So let us go into the topic. So before knowing like what is heavy period, you should know what is normal period. So normal period you is like between 21 to 35 days. It's actually everyone thinks 28 days or 30 days is a normal cycle. There is nothing like that. There is no fixed cycle of having 28 days for everyone. For each person, it's different. It might be for one person, it might be 21 days. Maybe I may have a 28 days. Other person may have 30 days. So from 21 to 35 days, any day is counted as normal. So this has to be calculated from the first day of your last period. Okay, so this lasts from 2 to 7 days. So some people say that they have bleeding only for 3 days. That is completely normal. If you're having normal flow and if the flow is not associated with any clots and all, that's absolutely normal. So when we call as normal period is 21 to 35 days and lasting from 2 to 7 days, and which is normal flow and no clots is considered as normal period. So coming to the second actual topic. So if you know the normal period, you can understand heavy periods. 8 to 27% of the girls or women are suffering with the heavy periods, and some of them doesn't go to schools, attend colleges or workplace, and they think it's normal and they never come outside, and because of the heavy bleeding, no, they suffer with the anemia, tiredness, fatigue, and they think it's normal. So this is the only thing I want to say. Like after, I think by the end of this topic you will know what is heavy period and when to go to the doctor, and you have to not ignore is the most important thing here. So what is heavy periods? What are heavy periods? Bleeding more than 7 days and passing clots more than 2 centimeters. See, heavy periods are completely subjective, because for some people they say like the bleeding is, even though the bleeding is normal, they think it is heavy. Or some people will have heavy and they think it as normal. So how to know how are heavy periods? So basically we only can understand ourselves because the period starts from the starting, and now how they are there, definitely you can understand the difference of the change of your periods. Like suddenly you are having heavy, like in the sense you are bleeding more than 7 days. Like normally you used to finish by 4 days, but your bleeding is more than 7 days. Now in the bleeding you are passing clots which are almost more than 2 centimeters. And period causes flooding. What is flooding? It is nothing but your linen, your clothes, your whatever, getting spotted with the blood and all means. That is again, though you're keeping good pads and normal, still you are having staining. Then you have to think about the heavy periods. And changing the pads, tampon more than 5 to 6 times a day, that is fully soaked pads more than 5 to 6 times a day also, you have to think about the heavy periods. And sometimes bleeding, you know that it is heavier, and sometimes some patients have fall in the hemoglobin drop, and that is the reason which causes a feeling of tiredness, weakness and fatigue. So definitely this is very important. Coming to the causes of heavy periods, this is very important. But I just want to mention there are structural causes, non-structural causes. Structural causes are completely related to the uterus, and non-structural causes are something out of the uterus. It might be medical problems, hormonal problems, or any other because of the drugs that causes heavy periods, or any other iatrogenic in that cycle, something like that. So it is very very important thing to find out whether it is related with the uterus, or if it is causing other because of the other medical problems. related problems other than the uterus. So the most common condition, medical conditions which are causing the heavy periods are like thyroid. The first thing we think is about thyroid. It might be hypothyroidism, it might be hyperthyroidism. Any thyroid issues are related with your bleeding problem. So whenever a patient comes with the heavy periods, so first we think about is thyroid. Second is about PCOS, and third medical condition is coagulation defects. So thyroid is very common. I will explain in later part. And polycystic ovarian syndrome. These are the medical conditions or gynec related conditions. These are more than gynec related. These are hormonal imbalances which causes these problems. And coming to the most common, and which other than the hormonal, is uterine fibroids. And we talk in detail later part. And uterine polyps and uterine infections and endometriosis, and also there are causes of heavy bleeding in that cycle, might be due to because of the copper T insertion, or sometimes there is undiagnosed miscarriages also causes, and also uterine malignancies. So coming to the polycystic ovarian syndrome, what happens in this hormonal polycystic and thyroid problems is, first thing is, in these problems we'll have anovulatory cycle. What happens in the anovulatory cycles is, the endometrium will be more thicker than the normal, and there will be no ovulation, and the lining will be thicker, and it will cause heavy bleeding and continuous bleeding for so long time. So what happens in the PCOS, other than, like the PCOS, the ovaries are normal, larger than the normal, and they secrete androgens, insulin, and testosterone, which are the things. And they also prevents ovulation, like I said, right? It causes anovulation and also irregular periods, or it may cause heavy continuous periods and all. People with may, that's what, they may have continuous heavy bleeding also. This is also one of the symptom of the PCOS. This is purely because of the anovulatory cycles, which happens even in the thyroid. Second thing is uterine fibroids. Uterine fibroids is are a common type of non-cancerous, because they are, most of the fibroids are non-cancerous, and that can grow in and also inside the uterus and sometimes outside the uterus. Not one thing is, all the fibroids are not symptomatic. That is, most of them are asymptomatic, and patients will be known only through the accidental scans and all, incidental finding visits. Some patients may have heavy bleeding, especially you can see the fibroid which is growing out. That is called, this is not much harmful, but it chances of growing higher, like larger sizes are more, that they are called subserous. Usually where I kept the arrow, they are not that harmful. When it coming to the, basically these fibroids are grown from the muscle of the uterus. So what happens, these are called, the culprits are, the most common things are this submucosal and also intramuscular. See, you can see this growth is present inside the muscle, and you can see this inside one is coming inside, now it is coming protruding into the cavity. So these two are the most common things which causes the heavy periods, and so, and additionally they are associated sometimes with the pain. So hormonal problems are one most important thing, is any hormonal problems usually have heavy bleeding, but they are not painful. But when it comes to the structural problems like uterus related problems like fibroids, which are have different types, but the most important thing in the fibroids are like intramuscular and also submucous. So what is the treatment, and what are the things which we later discuss later. Coming to the polyps, these are also something like grape like structures and the growths of the lining of the endometrium inside. You can see these are not fibroids, these are not muscular growth, these are just like a grape like thing, and which are like from the lining of the endometrium, and they're very small. They can grow up to 2 centimeters and all. And this again are non-cancerous problems, but they may cause continuous spotting followed by heavy bleeding or continuous bleeding or all these problems. So these are the second common problems. common things which we usually think about. They may be inside or sometimes outside the cervix. So usually when someone says any bleeding problems, we examine outer side of the cervix, and also we do the scan to know what are the polyps. So these are the polyps attached to the inner wall of the uterus that expand into the uterus, and they can cause irregular menstrual bleeding. And sometimes post-menopausal also will complain of the heavy bleeding, and we most probably we think about uterine polyps. Coming to the endometriosis, like I said, this is the lining which has to be there inside the uterus. But if the lining is present outside in other places, the endometrium, which has to be here, if it is present in the ovary, it is called endometrioma, that is ovarian endometriosis. If it is present outside any other place, it is called as endometriosis other than the uterus. So this is also, the tissue often attaches itself to the ovaries or fallopian tubes, and again it causes abnormal heavy bleeding or cramps and severe. Along with the heavy bleeding, sometimes with heavy bleeding, it is associated with the pain during the periods, like fibroids. Even adenomyosis is also associated with the heavy bleeding and also with the painful cycles. So coming to the sometimes we should think about the infection part also. That is, one of thing is pelvic inflammatory disease. In this, usually patient presents with the lower abdominal pain, and also discharge, foul smelling discharge, and in that cycle they may have present with the heavy periods. So these also can present once in a while with the infections and all with the heavy period. So these are differential diagnosis which we think when someone comes with the heavy periods, but it's not always that PID causes the heavy bleeding. And coming to the uterine malignancy, yeah, is the last one which I want to talk, because usually postmenopausal part, or like perimenopausal, who sometimes in reproductive age also, if they are having heavy bleeding, then first we examine the cervix and see like whether they have any growth or not. And if they are having continuous anovulatory cycles, there is a chance of endometrial hyperplasia in later part with other additional factors like obesity and hypertension and other family histories. It may causes uterine cancer. Nothing but the endometrial, which is the lining of the endometrium inside, causes the endometrial cancer. So these are the major things which you have to think. When I said the medical problems, like we divided into medical problems and other problems, right? When we think about the medical problems like thyroid, PCOS, and also coagulation. So when we can identify this coagulation defects, like coagulation defects is like girl first time she got menarche, that like she has having menstrual cycles, and it's very heavy the time she started bleeding. Then you have to think about the coagulation problems, like because if she the cycle has to be normal, but if it is not normal and if she's bleeding heavily, then you can still think about the coagulation disorders. And coming to the medications, such as the medications like blood thinners, blood thinners also causes abnormal heavy menstruation. Some of the patients don't know, and they get worried about that. So whenever you come to the history, we see what are the medications they are going through. And undiagnosed miscarriage, like undiagnosed miscarriage is one of other reason which causes the bleeding, because some of the patients will think it's normal, but that cycle they may have heavy flow. And so whenever the patient comes with the heavy flow in that cycle, we usually do urine pregnancy test to rule out any other undiagnosed problems in that. Now, coming to the lifestyle factors. Yes, there are chances of lifestyle factors affecting your heavy flow, especially obesity. Again, indirectly, it will say weight gain, obesity, again, PCOS, and hormonal imbalance. I always stress on the weight thing problems, especially obesity and stress, because indirectly they will do so many things in the body. Because whatever, as a woman or a girl, whatever physical or mental stress it shows on the periods, even though you don't have any other medical problems, whatever you are feel stress, like mental stress or physical like exams or any other stress you are feeling continuously, and you're having night duties and you're not sleeping well, all these again affect the hormonal imbalance, and again they cause your heavy bleeding. periods. So how to tackle? First thing is, what are the ways to tackle this? First thing is, I always say don't ignore the symptoms, because if it is normal symptom, your brain doesn't tell that. But if the body is showing some signs like these things, like which are normal previously, and suddenly there is a sudden change of your periods, you should not ignore them. And please don't take medications like counter like whatever you want, just go and pop up whatever you want, and taking directly from the medical stores and all is not advised. And don't ever follow the Google things whatever they say. So just most important thing is, please meet your gynecologist and get investigated. So what your gynecologist as a doctor we do is, first thing is detail history is very very important to know, like is that painful cycle or painless cycle. Is this cycle is first time, usually first cycle you have like this, usually we don't do too much of examination. But if you are having any other symptoms associated with the tiredness, fatigue, and you're having this heavy flow with the clots, and it's really causing you to not do as if it is affecting your physical, mental, and emotional stress, then it's a time you have to get treated. So the detailed history is very important regarding how are your cycles, any medications, or any thyroid issues, any weight gain issues, or any stress related, or any other family history of any other cancers or anything, are very very important. Coming to the clinical examination, yes, we do the clinical examination. We see whether you are paler or whether everything is fine, and we do the per speculum and per vaginal examination. As I told, per speculum examination shows us the cervix has any other erosions or any other polyps outside or any other problem outside the cervix. And clinical examination will give us some idea that there is some problem inside the uterus. Sometimes we can feel the fibroids and any ovarian cyst or like endometriosis, anything we can do through the, we can get information through the clinical examination. To confirm our clinical findings, we usually ask for the scans, that is vaginal ultrasound. We ask transvaginal. They're very important because transvaginal ultrasound helps us to know the lining of the endometrium, whether it's thin or thick, whether if they are having anovulatory cycles, usually it will be thick. And if sometimes the patients like having heavy continuous bleeding, so whether they have thin lining, sometimes because of shedding of the endometrium, some patients may have thin lining, but some patients may have thick lining. Even though some patients have thin lining, they will be having continuous bleeding. So these all the things, not only the lining of the endometrium, we can see the polyps and also the fibroids and other things through the scan. And coming to the blood investigations, we usually, if they're having continuous bleeding, we check whether their hemoglobin is fine or not, and also other needed hormonal tests like thyroids and other things. And sometimes if we require, we may require other blood hormonal tests also. So the most latest one, every time we talk about the hysteroscopy. What is hysteroscopy? Is here we can keep the scope inside if we suspect anything like a polyp or anything in the previous scan. So now, example, I'll tell a history. Now one patient comes with a heavy bleeding, and it is like continuous heavy bleeding. And I have a lot of patients who has come with the heavy bleeding continuously past 5 months, which are like continuous bleeding, and they have used a lot of progesterone tablets and on other on and off, but the bleeding not reduced. But when we did the scan, some patients we can see the polyp and directly we will ask for the hysteroscopy. But some patients we just see the lining of the endometrium and it is thick, and it's always better to go with the hysteroscopy. What does this hysteroscopy does? This hysteroscopy has a camera, which we small one, which is like very thin, and under anesthesia, or we can use this hysteroscopy keeping with camera, we can see inside the cavity of the uterus. So that is the advantage of the hysteroscopy, because we can just see this what is there inside, and we can know the cause and we can remove also. So basically it helps for the diagnosis and also for the treatment. That's the importance of the hysteroscopy. So when we see any polyps in the scan, or if we see very thick endometrium, even though they are bleeding for so long time, the endometrium is shedding, so it has to be thin, but still some patients have very thick endometrium, we directly suggest for the hysteroscopy and take the biopsy. biopsy, or we can remove the polyps there itself. That's the beauty of the hysteroscopy. So like this latest techniques have come. Just don't stick on to the routine your own treatments, and just don't keep pending and make them chronic problems. Coming to the treatment options, yes, when they have anemia, if we diagnose any anemia, because most of the patient, because of the heavy flow, no, they end up after they don't come in one cycle, so they end up with the anemia. So anemia is nothing but drop in the hemoglobin. So with first thing is first treat the basic thing, that is anemia. And if they have thyroid, like if we do blood investigation, if you find thyroid, definitely we ask for the thyroid test. And also PCOS, definitely PCOS is not something like one tablet treats the PCOS. I always tell PCOS is something called lifestyle treatment, and it is not a blanket treatment. It requires altogether treatment from the lifestyle modification, diet, and also our treatment. And especially lifestyle has a big role in the PCOS. So accordingly we treat. And any infection, because infection is something which if we treat in that cycle, they may be normal in that cycle only. That heavy bleeding can be reduced in that cycle, right? Coming to the medical management, what are the medications we usually use? That is NSAIDs. NSAIDs are nothing but non-steroidal inflammatory things which we use for the as a painkillers. So they also like meftal which reduces the spasm of the uterus. And also there are other medications like tranexamic acid, which are helps to reduce the bleeding, and other. And oral contraceptive pills, which are the hormonal pills which have estrogen and progesterone together. This is not like again blanket treatment, just people come for the bleeding. We just cannot give for all the cases. We won't suggest for the NSAID. For all the cases we don't suggest for the OCP pills. It depends on the case to case. And sometimes we can use only progesterone pills also. Luckily we have progesterone containing intrauterine device. This is a device which has a progesterone, fixed progesterone, and it releases every day. And it's my most favorite medical management part, because it has its own role to reduce all these problems, and also endometrial hyperplasia and other all bleeding problems like heavy, and also in role of fibroid reduction and all. So these are the medical management things which we usually, as a first line treatment, we go with it. Either tranexamic posmf or tranexamic acid related things, or hormonal pills, either estrogen and progesterone combination, or we go with the plain progesterone. Or if it is chronic and if it is causing other problems, if the patient cannot take daily tablets, we still have option of IUD containing progesterone, which is called Marina. And coming to the surgical management, yeah, surgical management is also, I say, like it's not objective, like, or we just cannot treat in that way. Once if the medical management is not working, or if it is not improving with the medical management, then depends upon the again case to case, we will go with the myomectomy. That is nothing but if you have fibroids, we'll remove, the problem is solved. And if you have polyps that is causing heavy bleeding, polypectomy is one of the thing which helps. And hysterectomy is a removal of the uterus, which is the last resort, which I use for the everything. After everything is done, also the patient is having severe bleeding, that's the last resort. So nowadays we have lot of technology has come. There are non-surgical managements also, like uterine artery embolization or hypho. All these things are have come up. So it's not always like once you come we just do the surgery. It's not like that. First of all, my sincere request is for everyone, just don't ignore the symptoms, because usually I see the patient doesn't come one or two cycles, they come after 6 months, 8 months with anemia or severe bleeding or endometrial hyperplasia, or they may see fibroid size increasing, they get scared to do the scan and all. So first thing is you have to. So what can we do to manage heavy periods naturally? Yeah, I know, like everyone thinks like for everything we cannot take all the medications, and we cannot always come to the doctor, right? So what can we do naturally is like iron rich, right? Because we lose blood every month, so it's always better to add all these foods in your diet. Definitely iron rich diet is one of the important thing. It, you can add can have, I usually say to have leafy vegetables, even peanuts with jaggery, like other things, raisins, you can have apricots. All these things are iron rich diet, and you can choose accordingly. And please add in your diet iron rich, and avoid tea and caffeine, that is coffee, because again they will interfere in the absorption of the iron. So try to reduce your coffee intake and tea intake. And vitamin supplements very important, like vitamin D, B12, and vitamin C rich diets, or supplements like iron tablets when you're bleeding more, or if you're having anemia, you can please start on these things. And plant-based diet, definitely, like legumes and leafy vegetables and all. You can try to consciously add these things in your diet. So really it will be beneficial, because nowadays we are all are busy and we don't even think about what we are eating. So mindful eating of good plant-based and very important. And coming that, avoid plastic. Why I said this, because plastics has, every time I tell about this, the plastics has xenoestrogen, which mimics our estrogen, and these are not good. And these plastic related boxes which we use, or any plastic related things which we use to store our food, or to hot food when we keep on that, try to avoid the plastic. That's the most important thing. And also, because estrogen containing diet like soya and all, it's better to reduce them. And finally, exercise has its own role, like it has lot of benefits. It might not only exercise means, it includes walking, yoga, pilates, anything, but any movement of your body is very, 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 very important for all your hormonal problems, and also for your stress related things, and in the future chronic problems, chronic medical diseases. So definitely exercise. Like I said, iron rich diet, like I mentioned, apricots, raisins, leaf vegetables, and all these legumes and all. And supplements you can start within. And healthy lifestyle, like I said, healthy diet, avoid junk food and plastics, like I said, and physical exercise, yoga, and de-stress, doing journaling and all. Sleep hygiene is again one more very, very important. Every time I mention, it's not about how many hours you slept, but it's always having perfect sleep hygiene, sleeping on the same time, and having healthy sleep is also very important. And try to avoid the junk food, because this junk food and plastic related food all have excessive estrogen, which is not good. And try to move your body, like as I said, and de-stress yourself. Like I said, mention, like estrogens are present in the plastic related food materials and food bowls and bottles. Try to constrain them or avoid them. So finally, the take home message is, however, I know it is common, please don't ignore any symptoms, because I see so many times the patient never comes to the hospital or immediately. Please don't ignore any symptoms, and right diagnosis, right treatment is the key to solve the problem. So you cannot diagnose yourself, definitely you need the doctor's help. So please come and try to maintain a healthy lifestyle, and make sure you get enough rest and practice stress reduction, and see your gynecologist and for the regular checkups. Thank you. Any doubts you can mention in this box? Okay, I think there are no questions. So thank you, everyone, with patience. I think this information is useful. If anything, you can please ask in the comments. Thank you.